Hi, I'm Jessie Young with the Research Committee for the ACA Pediatrics Council. I'm here today with Dr. Hestbaek. She is a professor at the Department of Sports and Science, Clinical Biomechanics, the University of Southern Denmark, and senior researcher at the Chiropractic Knowledge Hub. Thank you so much for joining us today, Dr. Hestbaek.
My pleasure.
Yes, and we're here today to talk about pediatric care for headaches and your recent publication on the randomized controlled trial you did. Do you want to talk a bit about that?
Sure. This has been a large wish for me for several years to investigate this, because we see so many children in the clinics and they really suffer. It has huge consequences for their lives when they have these chronic headaches. Mm-hmm. Learning disabilities and poor academic performance, poor quality of life, and there are a lot of consequences in the long run. And then a few years ago, I was approached by a chiropractor who has the same interest and who also has a master's in pediatrics, and she wanted to do the trial. So we teamed up and did it. And we're really happy that we succeeded. We got the funding and we got the results that we sort of hoped for, where we actually see a reduction in number of headache days in these children. And we are only including children with recurrent headache. They have to have at least 6 months with headache at least once a week. So it's been going on for a long time and it's frequent.
Mm-hmm.
Yeah,
I was one of those children growing up. That was the reason why I started going to the chiropractor in the first place. I was about 9 with headaches, and so this was a really exciting paper for me to read through. And I was amazed at how long it from the time you started it to the time of publication. About how long were you working on this project?
Actually, I was surprised at how fast it went. Because before becoming a full-time researcher, I was in clinic and we did see headache patients and children as well. But when we recruited chronic patients with weekly headaches for more than 6 months in the age group 7 to 14 years of age, I didn't expect there to be so many. And we only recruited from a small area and into one clinic with one chiropractor. So there was a limit to how quickly we could get the children through. But as it turned out, when we started recruiting through the school internal communication systems, networks, and there was about 2 or 3 in each class that actually called the clinic for information. Some of them weren't eligible, but just the interest that they actually called up to the project secretary to hear about the project indicate that they were suffering. So we're talking about maybe 10% of all the children in that area with that severe amount of headache. That surprised me. Yeah, but also confirmed that it's an important study.
Absolutely. And you talk about in the paper the alternatives or the other things that those children had done before chiropractic care.
Yes, and that was surprisingly little, because I don't think a lot of times the children are not taken seriously enough with headaches. It's sort of the same we see with back pain and neck, maybe not neck, but especially back pain. It's something, it'll go away. Maybe it's just because you don't want to do your homework or you don't want to do physical education, or it's sort of brushed off a lot of times, both from the parents, but also from the GPs and other healthcare providers. So, but of course they did have seen their GP. Some of them have been to the pediatrician, but nothing had helped. Otherwise, the ones that were helped obviously didn't consult us, but it's important to remember that the medication for migraine also have a lot of side effects. So if we can give them another type of treatment without side effects, it's definitely worth considering.
Absolutely. And we were talking briefly about that before, and some of the other literature that you are referencing in this paper. Are there any other, this was the first RCT of headaches. Are there any other studies that we need to be aware of regarding headaches that would go nicely with this as we're sharing this information with our medical colleagues?
Well, as far as I know, we haven't seen trials investigating manipulation of pediatric headaches. And if we look at the adult literature, there is some evidence that manipulated SMT might be beneficial. Mm-hmm. But we have to be careful just to extrapolate results from adult population into children. And especially in headaches, it seems that the distinction between migraine and tension type headache and other type of headaches are more difficult. And we see more mixed headaches with the children. So in sort of within adult headaches, science tends to be very strict in differentiating between the headache types, which makes it a bit difficult to extrapolate results to the children.
Interesting. And I know in low back pain, we know that children with low back pain are more likely to become adults with low back pain. Do we know if that's the case with headaches? Are children that experience headaches more likely to as adults?
That's definitely the case with headache. Mm-hmm. There's quite a lot of studies indicating the severe long-term consequences of pediatric headaches. They have a trajectory where they continue, and we're talking about huge odds ratio in different studies where 25 years later, the odds ratio of recurrent headache will be something like, I think it's around 12 in one study. Mm. But also there a very nice study with showing trajectories of headache in adolescents, where they register headaches once a year over a 4-year period. And there are some trajectories where they are either increasing or staying stable in that 4-year period. And then when they go back several years later, the ones with the unfavorable trajectories during adolescence, they're the ones who really suffer from recurrent headaches in adulthood. So it's definitely worth taking it seriously early, because we might have a window of opportunity to change those lifetime trajectories. We've seen that with low back pain, that once you are adult, it's difficult to change your long-term trajectory of low back pain. But when you look at the same type of trajectory patterns during adolescence, they go up and down all the time. So they're not stable in the adolescent years. But once you get up in your 30s, it's difficult to change. But you probably have a better chance of improving the lifetime trajectory if we treat them early.
That's so exciting to know. Can be so life-changing for these little ones. And you also go into your paper in detail about how many treatments that you studied and how long the care was. From your paper or from other information that you have, what should our doctors be expecting as far as results in timeline wise with children? Is it similar to adults, or are there results sooner or?
that depends on the child and the condition. I've never been in favor of cookbook solutions. But in this case, where we have the chronic headaches, you can't expect to change that in 2 weeks' time. So that's why we wanted to measure it over a 4-month period. And we do have 12 months follow-up as well, which is not reported yet. But I think in this case, we sort of guessed that the amount of that number of treatment within the 4-month period would be 8. So that's what we used for the control group. But as it turned out, we actually got, I think, an average of 11 treatments per child for the treatment group. So, but it's also an age group where they often fall and hurt themselves, and that sometimes set the treatment back as well, because then you have to sort of get that sorted first before you can continue and get back to where you were before the injury. But that's chronic 7 to 14-year-old. But if you're looking at like infants for infantile colic, the trial we did there, we had 4 treatments in 2 weeks. And some of the chiropractors said that a few of the children had not completed treatment after those 2 weeks. But most of them had. And for certain, if there was to be any improvement, you will see it by then. So we've actually, and that's an important point when you say in relation to communication with our medical colleagues, because we just published some guidelines about infant care in chiropractic clinic. And one of the points there is that for an infant, you need to see results within 2 weeks, otherwise you should reconsider. And that one point was the one that really was so much appreciated by the medical community, because their concern is that if you get into a chiropractor, you will never get out. And of course, that's not the truth, but it is a myth out there. And just coining that one sentence in the whole guideline, which was 5 pages or whatever, but that one sentence that if you don't see an improvement after 2 weeks, you have to change your horse. That's the one that was really appreciated by people outside our own profession.
I completely agree. I get that question all the time from providers and from parents. If I start coming to the chiropractor, am I going to have to come forever? And it's they always feel comfort in knowing that that's not the case, and it's wonderful to have the literature to support that. Did you have any other advice or any other anything else to share with us today?
Well, if we want to get back to the trial, I think there's one thing that must be remembered that sort of sometimes get lost in the detail, but the control group actually got a really good treatment and a lot more treatment than usual care. They got the attention 8 times during 4 months, and they got all the available evidence-based advice we could find. They got that as well, about drinking enough water, getting physical activity, limit screen-based activity, and so forth. So it's not, the comparison is not between chiropractic treatment or nothing. The comparison is between almost a golden standard treatment without spine manipulation, and then the same golden standard with the spine manipulation added. So the difference in outcome is more or less purely related to the spine manipulation itself.
Yeah, I was really happy to read how many of the control children got better too. It was, but there was still
that is important, because just taking these children seriously and giving them good advice and make them feel that they're listened to. And the headache is not just something to be brushed away.
Yeah, absolutely. And so what is your takeaway for us? Like, what, as we're talking about this trial, what are some of the, maybe the one sentence that we should be sharing about the evidence for pediatric chiropractic care in adolescent headaches?
In one sentence, take it seriously, because most of these children can be helped one way or another, and you owe them to try, because we have not seen any side effects from this. And the consequences for not treating them can be really large.
Yeah. Excellent. Thank you so much, Dr. Hestbaek.
My pleasure.